Good afternoon, everyone. My name is Tom Sequist. I am a primary care physician here in Boston at Brigham and Women's Hospital. I'm also the Chief Patient Experience and Equity Officer at Mass General Brigham and a professor of medicine and healthcare policy at Harvard Medical School. So I wanted to share with you a little bit about my personal background and sort of my journey that has brought me to my current role, and then talk some about our organization here and our commitment to fighting for equity and anti-racism. I am American Indian. I am a member of the Taos Pueblo tribe, which is a American Indian tribe and community in northern New Mexico. My mother was raised on the reservation. I have had a lot of experiences with many different communities, Native communities across the country over decades. And a lot of that experience, including the experience, my own experience and my family's experience in terms of difficulties accessing care and poor outcomes and a long list of injustices that many in this country experience, I have committed my life and my career to addressing equity and to fighting for justice and combating structural racism. Right now in my organization, my primary role is to oversee programs like quality and safety, to oversee patient experience, to oversee equity and community health. And what I want to do is describe to you a little bit about our organization and our approach to that. So Mass General Brigham, for those who aren't aware, is a health system, a Harvard-affiliated health system here in Eastern Massachusetts. It's a collection of hospitals, both academic medical centers, such as Mass General Hospital and Brigham and Women's Hospital, specialty hospitals like Mass Eye and Ear and McLean Hospital and Spalding Rehabilitation Hospital and Network, and then community hospitals, a variety of community hospitals around Eastern Massachusetts, Western Massachusetts, New Hampshire, and Cape Cod and Martha's Vineyard and Nantucket. It is an organization that has 80,000 employees. We have over 6,000 physicians practicing in our system, and we care for nearly 1 million primary care patients. Last year, as many of us saw during the COVID pandemic, we built out a response to the COVID pandemic from the healthcare delivery system lens. But I think all of us were subject to seeing the effects of the COVID pandemic on so many of the communities that we served around the Black and Latino and Indigenous communities, around communities with limited access to resources. And I personally had a role in our health system of leading the operations response to the COVID pandemic. And in that space, was able to build out a health equity response as part of our system-wide incident command structure. I also was able to work with Native communities in their response to the COVID pandemic, in particular the Navajo Nation. And I think that fundamentally what happened in our organization at Mass General Brigham is that many more people became very, very aware of the importance of social determinants of health, social risk factors, of the existence of structural racism, and the very real impacts that can have on the health of communities, on the health of diverse populations. And I think in that awakening grew out a real calling in our organization to have a real strategic priority to address equity and to promote an anti-racism as a culture across our organization. So right now we have a platform across Mass General Brigham called United Against Racism. It's a platform that really has 3 core components to it, which include our workforce, patients, and the communities that we serve. And so, that to me is a real victory in that this is one of our top 5 strategic priorities for the system. It is where we have invested significant resources to make sure that we hit our strategic goals as part of this platform. It is something that is supported from the board and our executive committees down through our senior executives, including presidents, our CEO, myself, all of our quality and safety teams. And it is something that is being diffused widely across our organization. And I guess what I would say is, how did we, or what I wanted to talk about a little bit is, how did we get to this point in our organization? Because this has represented a real fundamental shift in how the level of priority that we've given to promoting equity and being anti-racist as an organization. And I do think that one of the things that initially opened up the door was the COVID pandemic. This was closely followed by the murder of Mr. Floyd, which I'm sure we all recognize caused nationwide attention to this important issue. Those two things combined actually allowed us to proceed through what I think was a very structured set of discussions with our board and with our executive leaders, with all of our clinical and administrative leaders across the organization about how does a healthcare delivery system respond? What are the areas that we can take on and really demonstrate that we can be impactful in this space, that we can partner with patients, that we can partner with our communities, that the communities that we serve to address equity in a real, meaningful, and lasting way. We did this by saying that we will A, set this as a strategic priority, that we will B, set goals, really accountable goals and metrics, and then C, we will hold ourselves accountable to achieving those. And that these goals actually are being set and are being worked on by all aspects of the organization. So it's not just an equity team that's working on this. It is every senior vice president. It is HR, it is operations, it is quality and safety and population management, it is our IS department, it is the entire spectrum of our healthcare organization has been given goals to achieve as part of our United Against Racism platform. In order to make sure that those goals were achievable, one of the really important things that we ensured was that there was adequate resources and funding. So we didn't want everyone to feel like this is a priority, a high priority, and we haven't funded it, and we're just asking you to do it in your spare time or on the backs of everything else or on top of everything else that you're doing. And so in setting it as a priority, we are asking our entire 80,000 to set aside other things in favor of the work around equity and anti-racism. And then we are providing the resources, people in dollars, to support the work that we are doing. And I think that was a really important set of process that we went through to ensure that we could end up in the place that we are at right now. I'm really excited that we have this platform because we are addressing everything from improving our collection of patient race, ethnicity, and preferred language, improving our collection of social risk factors like housing and food insecurity among our primary care patient population, to working on access to care through our payer contracting strategies, through our language access services like translator and interpreter services, and through our digital access programs, our virtual visit programs, our online patient portal platform, making sure that our patients have access to all the different mechanisms by which one can receive care in our system. We're also really excited to work on the elimination of racialized medicine in our system. So, and by that, I mean the elimination of the inappropriate use of patient race in individual clinical decision-making and algorithms. For example, removal of race from kidney function estimators, removal of race from cardiac function estimators, which are used to guide treatment decisions and medication decisions. We're also hard at work on what I call establishing a culture of equity improvement among all of our clinical departments. We have 18 clinical departments, so medicine, surgery, OB, emergency medicine. Each one of these departments has been required across all of our hospitals to implement an equity improvement project and to go through process improvement training so that we can learn which of these equity improvement projects work and which don't. And while one of the goals is, in fact, to improve equity in that particular space, whether it's use of restraints in the emergency room or decisions around birthing options for patients who are pregnant. The other larger goal is to have all of these departments and the hundreds of people now working on equity improvement to be engaged in this process and to understand and to realize that we expect equity improvement to be a part of our daily work, much like safety improvement. We're also working on new models of primary care. We are building out a mobile health service line that will connect and integrate with primary care so that we can deliver preventive services, vaccinations, cancer screening, chronic disease services like diabetes or hypertension care, and mental health services, including substance use disorder services out in the community, but with an important link to our primary care so that it is an operational service line built into our clinical programs. And of course, we will use our voice at Mass General Brigham to advocate for what we think is right, whether it's universal broadband access, housing and food insecurity, or better access to substance use disorder treatment programs. So I guess what I would say, in closing is we have been on a very long journey for years and years. At the board level, at least 5 years of showing data around equity and the opportunities we have for improvement. We have certainly accelerated that journey over the past 12 months, dating back to last summer. And I would say that for other organizations that are going down this road as well, or that have already gone down this road, I think it's important for us to approach this work with a lot of, importantly, we should have passion around it. We should have commitment, and that commitment has to be reflected in resources and financing. But we should also approach it with a lot of humility. We don't actually know, as a healthcare system, all of the best solutions to address these, very, very large problems. And what we are doing at Mass General Brigham is trying out solutions, making significant investments, large enough investments, so that we can have a good idea of what things are working and what things are not working. And I say humility because I think it's really important to acknowledge these are extraordinarily large issues that have been going on for 500 years among some communities in the U.S. And it is not realistic to think that we are going to charge in and solve all of these issues in a single year. But what is important is that we make that commitment. And lastly, I would say the humility piece is important because we have a lot as a healthcare system, not just our healthcare system here in Boston, but across the entire U.S. We have a lot of work to do to build stronger trust relationships with the communities that we serve, with diverse patient populations. And part of building back that trust will be showing that we have a true and strong and lasting commitment to this space, and that we have built a culture throughout our organization that will actually help us achieve the goals that we are setting out for. So we at Mass General Brigham are extraordinarily excited for our United Against Racism platform and hope to be able to share more and more of our learning in the year to come. Thank you.